70 million to 190 million? This number must be remembered. Many of my clients often ask me, is the dose of stem cells the better? In 2019, the Rutgers University Stem Cell Research Center in the United States did a study for a period of 14 years, 28 different stem cell clinical trials. Through clinical trials showed that the amount of stem cell input is not the more the better. So at what dose is the effect good? Studies show that it is between 70 million and 190 million. Less than 70 million usually has no obvious effect, but when the dose exceeds 190 million, its effect does not rise but decline, and accompanied by adverse reactions, so the number of stem cells is not the better. Before you go to the cell, you need to go to the hospital to do a comprehensive physical examination. According to the physical examination report can judge, first, whether you are suitable to use stem cells. Second, how much dose your body needs to use is safe for you personally, is effective. I'm going to go on to share the difference between the amount of immune cells and the amount of stem cells. The difference between the amount of immune cells and the amount of stem cells is very big, and here we will talk about the reason. First of all, we need to understand the difference between stem cells and immune cells. Normally, when we do stem cells, many experts will determine the dosage according to the different weight of each of us. For example, every 15 kilos of body weight can be used to the amount of 10 million cells. This dose is safe because the shape of stem cells is oval. When we inject cells back into the body, it will first enter the heart, and then it flows into the lungs, and when it gets to the lungs, the oval stem cells, they tend to form clumps, and if you have too much input at one time, it can easily cause pulmonary embolism, which is a very, very big risk. Then why the amount of immune cells transfused is very large. For example, there are 3 billion or even 5 billion or even 10 billion are no problem. Because immune cells, it is a ball shape, its size is much smaller than stem cells, large doses of input into the body is not easy to cluster since there is no such clustering, which means that the risk of pulmonary embolism is almost no, so immune cells can be transfused in large doses. Secondly, the way stem cells and immune cells work is actually not the same. Stem cells are builders doing addition. When stem cells into the body, it will find your weak parts, repair. It is a process of regeneration and proliferation. And the immune cells, it's like a SWAT team in our body. It wants to sweep out all the cells in your body, such as viruses, bacteria, some mutations, so the immune cells are doing subtraction. Just because they work in different modes, one is doing addition and the other is doing subtraction, so the amount of addition is relatively small and the amount of subtraction can be more, which is a very obvious difference. In general, the selection of therapeutic doses for stem cells and immune cells is a complex and scientific process that takes into account both the type of disease and the individual differences of the patient. Through scientific dose management, the effectiveness and safety of stem cell therapy will be better guaranteed, helping more patients to benefit.